and I am so happy to be putting this on with the ward committee. I'm going to hand it over to my friend Karen from the ward committee to introduce a bit about the ward committee before I talk about what we'll be covering today. Karen, over to you.
Thank you very much, David. Hi, I'm Karen Payne. I'm co-chair of Ward 19, and my other co-chair, David Asapit, is also with us this evening. And I just would like to say welcome and thank you all for attending this very important informational webinar on the COVID-19 vaccine. Ward 19 felt that it was really important for us to try to reach out to our community to educate them on the vaccine and the safety of the vaccine, and the need for people to become vaccinated for the COVID-19. And so together in such action. I really do appreciate our speakers this evening and you all attending this very important webinar. Back to you, David.
Great, thank you so much, Karen. So once again, my name is David Duong. I'm a primary care physician at the Brigham and Women's Hospital and also serve on the Ward 19 committee with Karen and David as well, along with many of you here. So today I helped put together a webinar series with my colleague, Dr. Lisa Cosimi, who's an infectious disease at the Brigham and Women's Hospital and has been really involved in Boston's testing efforts as well as vaccines and has a lot of knowledge about that. And then also with Penny's son, who is a master's in public health student at the Harvard Chan School of Public Health that's helped put together today's presentation. First, we'll go through the vaccine and its development, its safety concerns, and commonly asked questions, and Dr. Cosimi will do that. After that, I will take us through the state guidelines for vaccine deployment and then walk everyone through how to use maimmunizations.org to register and sign up for vaccines. And then finally, we will have a question and answer session for all of you so that you can ask us questions. And there may be questions that we know the answer to or questions that we don't know the answer to. If you have questions, please save them for the end, and we'll address them, and you can keep start putting them into the chat box right now, and my colleague Penny will be collecting them. So with that, I will pass it over to my colleague, Dr. Lisa Cosimi, for her presentation on the COVID vaccine.
Hi, everyone. My name is Lisa. I am an ID doc here at the Brigham. And as David said, I've been very involved in a testing effort. I'm a co-investigator of a big testing study called Test Boston, and then really taking care of patients on the floors and in my clinic. I am with David and Penny's input, and also just questions I've gotten from patients, friends, and families, put together a sort of commonly asked questions, but I'm happy to take any and all questions on the fly that might come up through this if I don't get to the burning questions that you all might have. So let's go to the next slide. I just pulled this from, actually this is yesterday's data, but this is where we stand today. As has been highly publicized, we've had a bit of a rocky start with vaccine rollout. I'm not going to go into sort of reasons behind that, except to say that implementation in large scale is a really hard thing to do, even when plans are very well laid out. David and I spend a lot of our time thinking about implementation and resources limited settings in an international setting, and there's so many lessons I think that can be learned from how implementation of vaccine rollout has gone in the US. But that being said, 34 million of us have received at least one dose. 10.8 million individuals are fully vaccinated, and we're now vaccinating about 1.5 million people per day. And this is with President Biden's goal to vaccinate 100 million individuals in the first 100 days. We're now hopefully looking towards being on track for that. In Massachusetts, also has been fairly well publicized that we've had a bit of a rocky rollout thus far. So at this point, 2.8% of the population is fully vaccinated, and 10% has had one shot. Next slide. So I thought I would just take you through the different types of vaccines. I'm going to spend the most time on the Pfizer Moderna, because those are what are available right now, what people are asking most about. If we need to come back and do this with the other vaccines in the future, we're happy to do that. But I'll do a brief overview of all of them and then focus a little bit more on the ones that are available right now. So this is the coronavirus. If you look at, my arrow won't work actually. If you look at the virus itself, it's an mRNA virus. That's okay. There's a outside, this is the outside protein layer, and the little lollipop with the multi-layer lollipop is the spike protein, and there's a messenger RNA core. Those are sort of the two big things to remember. And you've seen this picture many times now. Okay, so if you look at the different types of vaccines that could be developed for COVID or for SARS-CoV-2 or for any virus. So next slide, Penny. So the first virus is just dating back to Salk and Sabin is to look at developing a weakened or inactivated virus, and that's what was done with polio. There are some viruses, so the China virus, the China vaccine is an inactivated virus. Next slide. Inactivated vaccine, excuse me. The sort of the next type of virus that became more frequently developed, vaccine more frequently developed, is to use a piece of the virus. In many cases, that's going to be a protein on the outer layer of a virus. So the pneumococcal vaccine is a good example of this, the Pneumovax vaccine. And so one might take, and some groups are looking at this, developing a piece using the protein of the coronavirus to induce the immune response. Next. So you can also use another virus. So commonly viruses like an adenovirus can be used to put a piece of the messenger RNA or the piece of the genetic material that will then be delivered inside to the immune system to then deliver a message to cause the immune system to induce a response. And the J&J vaccine is a good example of that. Next slide. And so then the next thing you can do is you can just deliver the instructions themselves. So the messenger RNA will instruct the body to develop proteins in general. That's what messenger RNA. It instructs the system to develop proteins. And so messenger RNA vaccines really are just delivering the instructions for the body to develop an immune response. And so how do we do that? So that's the next slide. So, sorry, I need to move the gallery away. There we go. So essentially, you have a piece of the messenger RNA. And the interesting thing about messenger RNA, and actually one of the beneficial things that we'll get to, is that it's very easily degraded. It's really hard to work with messenger RNA because it degrades so quickly. RNA degrades so quickly. So messenger RNA vaccines carry the material that basically teach our cells how to make a harmless piece of spike protein. Next slide. They're going to be, they're degraded quickly. And so if we just deliver the messenger RNA itself, it would be degraded before it got to the cells, before it could deliver the message to the cells to induce that message. So what they do is they'll put it in a little fat cell called a liposome, and the liposome will protect the messenger RNA enough to be able to deliver it. But then once it delivers the message, it's essentially destroyed by the cells. Go ahead. Thanks. So then the message is delivered. The cells will then make a piece of what looks like spike protein. It's not the actual virus spike protein, but it's a spike protein on their surface. And then that triggers an immune response inside our bodies. Next slide. That produces antibodies to then protect us from getting infected if the SARS-CoV-2 virus enters our bodies. Next slide. So the key thing about this is that messenger RNA does not affect our DNA. It does not enter the cell nucleus. It doesn't get incorporated into the cells. It doesn't become latent in the cells. It just degrades. They don't cause COVID. This is an engineered piece of messenger RNA. So there's no live vaccine. There's no live virus. I keep saying virus instead of vaccine. And so they're not going to give someone COVID. We'll talk about the symptoms that people sometimes get after the vaccine, but they will not give someone active COVID disease. Next. So a lot of people have talked about, and I'm going to talk about the timeline, how fast this rolled out, the vaccines rolled out, and that these are new vaccines, and they are. But the technology is actually quite old and have been studied for many years. And that's one of the reasons why this was able to happen so quickly. So they've been studied for influenza, Zika, rabies, and cytomegalovirus, to name a few. Next slide. Okay, so how could they be developed so fast? The key here was the mobilization of infrastructure that was already in place. So just to go through what needs to be done to develop a vaccine. So this is developed into phases 1, 2, 3, and 4. 1, 2, and 3 happen before a vaccine or drug is approved by the FDA, and then phase 4 happens afterwards. So in phase 1, we're usually looking at safety. Are there any serious side effects? How does the vaccine dose relate to the side effects? Is the vaccine causing an immune response? So safety and immunogenicity, and that's usually in a small group. So then researchers try to answer in phase 2, assuming it advances from phase 1 to phase 2, what's the most common short-term side effect? What's the body's immune response? And are there signs that the vaccine is protective? One way to shorten the time that that vaccines or drugs are developed, and this is commonly done, sometimes that phases 1 and 2 will be combined and done at the same time. Phase 3 then takes at least 1,000 volunteers, and I'll show you the numbers for the Pfizer and Moderna studies, where researchers will try to ask in a larger group of people, how do the disease rates compare to people who get the vaccine and people who get placebo? And then how well does the vaccine protect people from the disease? At that point, the data is reviewed. If it looks ready to be approved, the data is reviewed by the FDA. And if approved, is rolled out. And then phase 4 continues with ongoing monitoring after FDA approval. Next slide. Okay, so let's look at the COVID-19, the Pfizer and Moderna by the numbers. So these are the last publicly released data that I'll review. And as you can see, the Pfizer's vaccine enrolled 45,000 individuals, Moderna 30,000 individuals. This was across the US. The racial and ethnic distribution was considered very diverse, much more diverse than many drug and vaccine trials have been successful at enrolling. And the age, as you can see, there's a wide range of ages in both the vaccine trials. Next slide. What was seen was that both of these vaccines were 95% effective at preventing COVID disease. Now, I have to say, none of us thought that they were going to be this effective. And to be fair, we're now, I think, because we're a little spoiled actually for future data coming out about vaccines, because actually the information on J&J and the AstraZeneca vaccine is actually really good protection. It just doesn't look as good as 95% effective. But really the efficacy of all the vaccines that have been, are the four now that have released larger data, they all look pretty good. But obviously these two look remarkable. And for, talking to the folks that were, so Lindsay Baden is here and was lead on the trial, no one was expecting it to look that good. Next slide. So are they safe? So more than 8 weeks of safety data were gathered after participants received their second dose in the trials. And it's really unusual for any side effects for any vaccine to appear more than 8 weeks after vaccination. So this is the same as, what we would look at for any vaccine that's in development. Individuals are still being followed. At least in the Moderna trial, they did unblind to let people know if they got placebo or actual vaccine, and offered vaccine to individuals that got placebo because the results looked so good. That the last I heard, and I'm sorry, I forgot to look this up before, Pfizer was still discussing whether they were going to do that or not. The most common side effects after vaccination occur after the second dose, but the most common side effects are arm pain. I had arm pain without question, fever, headaches, and muscle aches. And I would say fatigue is another big thing that comes after the second shot, especially. There's other sort of interesting, mild but more unusual side effects that have occurred. Some joint aches. One person that had COVID in the past had some funny sort of skin findings that was similar to her COVID infection. I look at this as, this is your immune response doing what it's supposed to do. This is the sign that your immune response is kicking in and making antibodies. So it's a good thing, actually. There have been, and this is also very well publicized, a small number of allergic reactions. Those tend to occur in people that have had anaphylaxis, severe allergic reactions to vaccines in particular, not people who've had food allergies or drug allergies. It's really specifically to vaccines in general. And I saw in the chat pop up, I don't think it's known yet exactly what the allergen is. There is a glycosylate. There might be something in the liposomal, the fat globule, if you will, that could induce, and very rarely in some people. But it's really extremely rare. And they're now, wow, sorry, I never let the lights go out. They're now looking at, or when you get the vaccine, they always have people watch you for 15 minutes. And if you've had an allergic reaction in the past, you stay for 30 minutes afterwards. And the reactions do tend to happen right away. Next slide. So what's an emergency use authorization? So the one thing, maybe I didn't put it in here. Actually, Penny, can you go to the next slide just for a sec? Let me just see what's in there. Okay, yeah, go back for then. So one thing people ask is, how did we do this so fast? And, we did in a year what often, people describe often takes years. And by we, I mean the scientists in general, not myself. One was making use of infrastructure that was already in place. Two is that there were both scientific infrastructure, so people that were already working on messenger RNA vaccines knew how to put mRNA into a liposome, into that fat globule. All they had to do was have the genetic information from this new virus and figure out what would be likely to cause induce the immune response, which turns out to be the spike protein, and then figure out how to put that into how to engineer that and then put that into a liposome. So that all of that was in place already. There were large vaccine trials networks in the Boston area. They made use of the vaccine networks that have been used for HIV vaccines. And so all of that staffing was in place, the infrastructure was in place to be testing, to be injecting and following people. Then once they got past the safety and immunogenicity, if you remember what was going on last July and August, we were starting to see a surge in the South and then the Midwest. So as they were entering phase 3, there was an active surge going on. So there were a lot of infections. And so very quickly, people that were in the trial were getting infected versus not getting infected. And that's why phase 3 happened so quickly. If we had had no COVID around at the time, no active infections, it would have taken a lot longer. So, or if we'd been trying to test in a country where there were very few infections. So instead we had a lot of infections very quickly, and those infections were in the placebo-controlled, or the placebo arm. So people ask, what is an emergency use authorization? What's an EUA? And just to clarify, so emergency use authorization is a infrastructure that is put in place specifically to prioritize either key medications, key diagnostics, or key vaccines that would be necessary in a pandemic situation. So the first thing everyone was talking about last winter, this time last year, was the EUA for diagnostics. So EUA for all of the testing that was being done. Then it was EUA for remdesivir and Regeneron and bamlanivimab, the monoclonal antibodies. So that they all use the same infrastructure, this emergency use authorization, where essentially the most important interventions to stop a pandemic are prioritized and gotten to the public safely and effectively and quickly as possible. So that before any intervention is authorized, the FDA is going to review all of the safety data from the clinical trials. And then the ACIP, which is in charge of all of the vaccine recommendations in the US, reviews all of the safety data before recommending use. So after vaccine authorization, the FDA, along with CDC, will closely monitor vaccine safety and side effects. And the CDC has set up a system called vSafe, and you'll get that information when you get vaccinated. Everyone gets the information for vSafe, such that if you do have side effects, or if anyone has side effects, those can be logged with CDC, and they're monitoring things very closely. Next slide. So what about the variants? And this is, there's less known, there's a lot of press, and like everything COVID, we're learning as we're doing right now. So some of this information I'm giving you now is from this past week and may change next week. But as of right now, so first I will say is that virus mutation is a normal and expected process in nature. We know this happens. RNA is, or RNA viruses tend to make mistakes when they make copies of themselves. That's commonly known. And the mistake that has a little bit of an edge up on its, on its viral friend next door is going to replicate more, and it's going to keep replicating. And so they learn how to evolve. So if there's a way that they can evolve to be a little bit stronger, or to evade a drug, or to evade a vaccine, they will do so. So the ones we've heard so far, the one we've heard the most of is the B117, which is the quote unquote London variant. And it does look like with B117 that most of the vaccines still do have are fairly efficacious against those. There has been there's been a little data that is coming out now about some potential loss of efficacy for the B1351, or what people refer to as the South Africa variant. And this is for J&J. It's unknown yet for the mRNA vaccines because they just haven't been tested. They have not been tested against these variants yet. The important thing to know, and a lot of press came out this past week about how, for example, South Africa decided to stop rolling out the AstraZeneca vaccine because it was less effective for the South Africa variant. If you look at that data closely, the vaccines were still very effective at preventing the more severe disease, which is hospitalizations and death. So there were more infections, this is true, but it was still effective at preventing the most severe outcomes. And that's what you really care about. If you can get people vaccinated and they're having colds, no, we don't want infections, but colds are okay, we can get over that. What you really want to do is prevent people from being in the hospital and prevent people from dying. So the other thing is that there's a lot of work in progress to be able to adapt the vaccines to address the variants. And both Pfizer and Moderna have announced that they should be able to essentially provide a booster that would be able to address the variants. So the take-home point I come away with here is that it's even more important for more people in the population to be vaccinated now, because the more we can stop the spread and the transmission of virus, the less chance it has to mutate.
Great, thank you so much, Lisa. We'll move on to the remainder of the slides, which is talking about how to get vaccinated in the state of Massachusetts and who's eligible and who's not eligible. Again, my name is David Duong, and I'm a primary care physician, and these are a lot of common questions that my patients ask me. So in the state of Massachusetts, vaccinations are free of charge. We currently vaccinate with the Pfizer vaccine or the Moderna vaccine, both of which are mRNA vaccines, like Dr. Kosmi said. So they are provided in 2 doses. And an important thing to say is that you should still get vaccinated even if you have had COVID in the past, or if you have documented or undocumented COVID in the past, you should still get vaccinated. So how do you sign up? So vaccinations are by appointment only. You can't just show up to the site, and you have to attest your eligibility in order to get vaccinated. And the eligibility criteria is listed on the state, and we'll go through that in a moment. But you don't need to have insurance, and you don't need to have a social security number to get vaccinated. You may be asked for identification. I've taken some people to get vaccinated and they weren't asked for identification, and other people were asked for identification. So when you go on to sign up for the COVID vaccination, you will be asked to attest, and you check the check boxes here. One of which says that you live, work, or study in the state of Massachusetts, and the other is that you are currently eligible as determined by the state of Massachusetts. This attestation form was taken today from the website. So today only phase 1 priority groups or those in phase 2 who are 75 years and older are eligible to get vaccinated. And then the sample types of identification cards that you may want to bring along with you that you could be asked for is an employer issued ID card that includes your name and title, or a government issued identification such as a driver's license or a recent pay stub. So again, nothing that needs to show that you have a social security number, no proof of insurance because vaccination is free. So when should you get vaccinated? So currently right now we are in April, so we are in phase 2. So to back up a bit, starting in December and then in January and through now, phase 1, which includes clinical and non-clinical healthcare workers doing direct COVID patient care. So people who are taking care of COVID patients, people who are living in long-term care facilities, such as nursing homes, rest homes, assisted living facilities, first responders, including paramedics, fire and police, people who live in congregate care settings, including the correctional facilities and shelters, home-based care workers, and healthcare workers who are doing non-COVID facing healthcare. So those, so that was phase one, and those people were eligible and currently are still eligible to get vaccinated. Right now, we have phase two individuals in order of priority, and the state has only prioritized individuals who are 75 and older to get the vaccine at this point in time. Then the next group will be individuals age 65 and older, or individuals with 2 or more comorbidities. The group after that will be early education and K through 12 workers, grocery store workers, etc. And then the last group of priority in phase two is individuals with 1 comorbidity, which means they have 1 illness, and we'll go through that list. And then hopefully by April through June, we will be providing vaccines to everyone else that did not qualify in phase one or phase two. So let's go more in detail into phase one and phase two. So for eligibility in phase one, we went through these people already, these criteria already. So people who are taking care of COVID patients, people who are healthcare workers, first responders, people who are living in long-term care facilities and rest homes. This is phase two. So that started off on February 1st, 2021. And right now we're only vaccinating individuals aged 75 and older. Yesterday, there was a new guideline published by the state that said that if you are driving or accompanying someone to vaccinate who is 75 and older, you may be able to also qualify to get vaccinated yourself. I've been suggesting that the drivers or people who are accompanying members of our community who are 75 and older call their vaccination clinic first to make sure that that's still available, because that could change. But that's currently the most updated guidance. After that, and we expect this sometime at the end of February, early March, is individuals age 65 or older, residents and staff of low income and affordable senior housing, and individuals with 2 medical conditions. So what are the medical conditions? Here we have cancer, chronic kidney disease, COPD or chronic obstructive pulmonary disease, Down syndrome, heart conditions, anyone who's immunocompromised, anyone who's classified as obese or severely obese, pregnancy, sickle cell disease, anyone who smokes, is actively smoking, or those who have type 2 diabetes. So that's going to be the next group that we expect to see sometime in late February or March. And again, this could change, but this is the current guidance issued by the state right now. And then after that group will be workers who are in early education, daycare, K through 12. So this includes teachers, those who work in our transit, so the T, rideshare, airlines, etc., utility shipping, grocery store workers, sanitation, public works workers, the court system, funeral workers, and then after that is individuals with 1 medical condition. So how do you get the vaccine? So I'm gonna stop my screen share now and take you to the vaccine sign up site and walk you through that process. So here we have maimmunizations.org. You will notice in this site that you can access it in English, in Spanish, in I think this is Chinese, and then in Portuguese, right there. So there's 4 languages that you can access this in. So after you confirm that you are eligible based on the criteria that I shared, you can go to this website and then click here, phase 1 and phase 2 clinics. So first, you're going to this part is optional up here, but you can say vaccination. We're in Jamaica Plain, so it's 02130. You can search by zip code and say that I want to search for a date sometime, can be as early as today. You can see in Marshfield that they have some vaccination sites today, but say I want to do it by next week, Wednesday. I click search and you can see all the areas around the 02130 website, zip code that are available. So here at Gillette Stadium, next week, Tuesday, I see that there are 2,374 available appointments. Reggie Lewis State Park Track Athletic Center, right by Tremont Street and Malcolm X, has 250 appointments. And then as you go down, you will get further away from the zip code that you entered. So let's just, for the sake of this webinar, just sign up at Gillette Stadium. So you have to select which priority group you are in. So I'm going to say I'm a COVID-facing healthcare worker. And then you have to attest that you live, work, or study in Massachusetts. You click this right here, and then you continue. So this is where you fill in your name. So I'm just going to put in my a test as my name. You select your race or ethnicity, or you can choose not to say that. You put in your birth date. And then you select your gender, and then you put in your email address. And if you don't have an email address, then you can just put in a generic address, such as something like this that I'm doing right now. Phone number, you have to have a valid phone number. So that's a phone number that I've selected. You put in your address. And then it's going to ask you to put in your insurance information. This is where a lot of people get scared because they're like, well, I don't want to be charged by this. It says your insurance will be charged for the cost. The vaccine is provided at no cost by the government. You can put in your insurance information here, or you can just say no insurance and then continue. And then you have to go through this series of questions that you have to complete. So is this your first dose or your second dose? Are you feeling sick today? No. Have you ever received this before? No. Have you had an allergic reaction? Have you received another vaccine in the last 14 days? No. Have you received passive antibody therapy to COVID-19? No. So ideally, you would click no through all of these questions, and unless you unless, for example, you're taking a blood thinner or you're pregnant, but I don't have any of that, so I'll just click no. And then you continue. So then it's going to give you a vaccine. This one only gives you one option. And it just reminds you that if this is your second dose, you must get the same brand as your first dose to be considered vaccinated. And then you basically sign your name right here. And then you can type in your name, which I'm just typing a generic name. So you review your details, you save and continue, and then you have your appointments. So you just basically go through this portal and you click when you want your appointment. So at 8:35 a.m. on Tuesday the 19th at Gillette Stadium, there's 28 appointments available. So you just basically click that. I'm not going to go through this because I'm not going to schedule an appointment. And then you click save and continue. And then it will send you, once you confirm it, it will send you an email confirmation to your mailbox. So it's pretty simple once you go through it, and it takes you through the system, but there are a lot of questions and buttons that you have to push. Okay. So let me go back to the screen share for the other. So you confirm your eligibility, you book your appointment through the location, and then you prepare for the appointment, which means you need to attest your eligibility, and you do that through the process. So the closest sites in Boston, in our zip code, the 02130 zip code, is the Fenway Park, the Reggie Lewis State Track and Athletic Center, and then there are some times that the Walgreens on Columbus Ave, Warren Street, or Morton Street are also available as well. So additional resources, you can go on mass.gov /COVID-19 vaccine. You can call 211 for more information, you can call the Governor's Office for Community Affairs, and then you can contact your primary care doctor. Your primary care doctor, depending on which health system you're in, whether you're part of Mass General, Brigham, or BIDMC, Leahy, or a community health center, or any other health system, they may have their own process for getting vaccinated. The process that I just took you through maimmunization.org is for you to schedule your own, but your primary care doctor may have more information access to the vaccines that have been allocated to the hospital system as well. Or you can go to maimmunizations.org for locations and then sign up yourself. So these are the additional resources. The other thing I want to highlight is tomorrow, the Boston Public Health Commission and the Age Strong Commission is doing another vaccine information session for seniors and their families. So you can register online on this link, and we'll be sure to post this presentation afterwards. And right now we will go to the question and answer session. So I'm going to stop my screen share, and Penny, do you want to feed us the questions?
Sure. I think there was some questions earlier about like how were the illnesses that were determined for achieving priority status determined.
Want to take that?
Let me just find the question itself. How are the medical conditions that bump people up within priority 2? How are they determined?
Yeah, so I can take that, David, if you want. So there's a lot of discussion about this. The advisory committee spent it, and there's a lot of ethical debate as well, but about who should go first. You know, the initial group though is really the group that is most likely to have the most severe outcomes based on what we know over the past year. It's who's going to end up in the hospital and who's going to be at risk of death. So that's it. So it's age, and you know, the age, obesity, diabetes, some of the immunosuppressing conditions, like, and then you know, lung diseases, and then some of the other rarer but have seen some severe outcomes, comorbidities.
Thank you. And then there's a couple other questions around what if you can't go to your appointment for whatever reason? Is there any way to notify people so that the appointment can show up as open for other people to sign up?
Yes, that's a great question. So you have to have a valid email address in order to in order to sign up, because that's how they will communicate with you. They will not call you. They will communicate with you via the email address. And when you get the email confirmation, you will get there will be an option to say, I can no longer make this appointment. And then you can click cancel on the email, and it will cancel the appointment and allow you to prompt you to make another appointment. The other thing is, when you show up to get vaccinated, you will not be scheduled for a second appointment at the first appointment's vaccination. That will be sent to you along in an email address, to the same email address, where you can get to pick when and where you will get vaccinated for the #2 vaccine as well. So it's really important to use the email address that you normally use, and it's a valid email address. And you should always check your junk mail as well if you haven't received it. Usually the email confirmation comes through within 5 to 10 minutes. So rely on that.
And then another question is around when people get the vaccine, do they have any proof that they've gotten the vaccine that they can show their employers with or without insurance information attached?
Penny, can you ask the question again? I'm sorry.
Sorry. So it's about what happens after you get your vaccine. Is there any record that you can show to your employer if you need to show proof, and with or without insurance information attached?
Yeah, that's a great question. So you should be given a vaccine card that's been issued by the Centers for Disease Control and the Department of Health and Human Services. And it's a paper card where the person who does the vaccination will write on it when you got your name, date of birth, when you got the vaccine, where you got the vaccine, and what type of vaccine you got. So that will be kind of your ticket when you bring it into the next vaccine, and they'll complete that. So you will be given documentation.
Great. And then there's a couple more questions about the vaccine trials themselves in terms of how COVID disease was defined and was severity considered. And was there any testing for how participants were or were not able to continue to spread the disease?
Yeah, no, it's an excellent question, and there's a lot of discussion about that now. So the trials looked at, so for Moderna, for example, they swabbed once a month. They swabbed when they came back to get their second vaccination, and then they started to swab once a month. But they weren't swabbing daily, weekly, to know whether or not people were getting very mild or asymptomatic disease. So it is one of the questions that is trying to be answered now. There's studies going on at the MGB system, enrolling healthcare workers to be swabbing themselves once a week after vaccination. So we don't yet know this question of, could there be asymptomatic spread after vaccination, which is why you still have Dr. Fauci saying, please make sure you're masking and socially distancing even after you're vaccinated. The way we know that vaccines should work with milder disease, we think there's less virus here to be spreading to other people. So it should reduce the spread. But again, it's an evolving, what we know about the disease is evolving. So that's the reason for that. And then the severity of disease, yes, they were looking at severity of disease. So hospitalized, not hospitalized, on oxygen, not on oxygen, not on oxygen.
And for people who don't have email address, everything that we know that the state is doing is through online sources. So for people who don't have access to that, is there a number? How do they access the appointments?
Yeah, that's a great question. So there's the 311 number, or the number that we showed that you can call the governor's hotline. And that's how they can access it if they can't register online or they don't have an email address. Also, if they don't have an email address but do have a primary care provider, that's another way to access vaccinations as well. I see a message in here from Diego regarding questions of transgender and non-binary people who have discrepancies. So there is an option in the sign up to not disclose your gender or not have male or female. You can always choose a no insurance option. I quite frankly, because the federal government's providing it, I don't know why the state is collecting insurance information, but you can always click no insurance as well. The card that is given at the end of the vaccination, once you complete the first vaccination and then at the second vaccination, does not, you don't need to fill out the gender information for it. It's just name and then the type of vaccine you got and when and where you got and when you got it.
Great. And we have another question around how will we know how long the vaccine provides protection?
Yeah, it's a good question. We don't know yet. We don't know whether or not we're gonna have to have a booster every year yet, and that may be the case at least for the next couple of years. It's my guess is that long term, and I'm not going to make a prediction on number of years, but long term coronavirus will probably become endemic, and it may just be sort of a cold-like illness. But how many years we might have to get vaccinated, I think is an open question at this point.
And then were there any guidelines from the state around service providers about not wasting vaccines in case they have extras or people don't show up?
I don't know the answer to that. And I think I think I probably know what you all know, which is what we hear that comes out of the press periodically. At MGB, from what I've heard, we've done a very good job about not wasting vaccine. But I have heard cases of, out in the community where vaccine has been wasted. But then we've also heard, people calling in anyone in the parking lot to come get vaccinated to try not to waste vaccine. I think one of the reasons why they expanded to the companion could get vaccinated was because of this. There's open slots, and they also don't want to waste vaccine at the end of the day. And the goal is really to get vaccine in arms. It's not perfect by any means. You know, it's not necessarily. And there was a question earlier on that I just wanted to, I looked up because I wanted to have the right numbers for the what we know about the numbers for severe allergic reactions. So the CDC, the mortality and morbidity weekly report that the CDC MMWR releases in December, they released 2 MMWR reports for the Pfizer and Moderna vaccines after essentially all of the December vaccine doses had been administered, and the Pfizer had 11 per 1 million, and Moderna had 2 per 1 million severe allergic reactions. So it's extremely low.
And then there were a couple of notes around providers like Carewell who are not going by the state level guidelines and not using these priority levels to determine the vaccine allocation. And if there is anything that can be done around those providers.
Penny, can you repeat the question? I'm sorry, I didn't catch it.
So there are certain providers like Carewell and perhaps some of the hospitals, they have their own internal ways of providing the vaccine and are not going by the priority level set by the state. Is there anything that can or should be done about that?
My understanding is that health systems have to abide or are highly recommended to abide by the state. If they are not, I mean, they could, I don't know what repercussions there are for that, but they've been advised to abide by the state. I think that there's been some questions about this extra vaccine, like if they have vaccine, the doses just left over and what they're doing with that, but I don't know the answer to that question. I'm sorry.
I hadn't heard that, so I don't have any information on that.
And we had previously mentioned several diseases that are identified by the state as comorbidities, qualifying for higher priority status. If you have a similarly severe comorbidity, but it isn't one of the ones that's listed, how should you manage that?
I think that's where you should contact your primary care provider and have a discussion with your provider about that disease and that disease category. But the state has clearly listed the what it considers as a comorbidity. So you can see that chronic obstructive lung disease is considered a comorbidity, but asthma is not considered a comorbidity, even though they're both chronic lung diseases. So that's the guidance that the state has given. And I think that I would recommend to have a conversation with your primary care provider. I see a question from Michelle Johnson about companion vaccines. Again, this guidance is new, so you can see that the guidance keeps changing and it keeps evolving. So it's really important to stay up to date. And some of the information that Lisa, Penny, and I are sharing with you today may be not up to date tomorrow. So please understand that. And it's not our intention to mislead or misinform. So because the companion vaccine guidance was issued yesterday, I recommend that if you are a companion to someone, to call the site that you're taking them to see how they're managing it. Because what we don't want is if they don't have enough vaccines, then a lot of people kind of lining up and then not being able to get it as well. So, so I would recommend you to call the site ahead of time.
And finally, David, could you repeat the information about the event tomorrow?
Yep. So the Boston Public Health Commission and the Committee on Aging is having a webinar that's geared towards seniors and their family members. It's at 2 p.m. tomorrow, and and there's a link to it which I will put into the chat box right now. Any other questions?
I think everything that has been covered in the chat has been said. If anyone else has any questions, please feel free to say it in the chat and let us know.
I don't know how to write it out on the chat, sorry.
Go ahead, Glenda.
Oh,
Please ask
okay.
your question.
I am sorry, came in a little late. Did anybody ask about the Johnson & Johnson vaccine?
No. What is your question about the Johnson
My
& Johnson
question is,
vaccine?
I don't think it's been approved yet, but if it is approved, it doesn't seem to be as effective as Pfizer and Moderna. So if I get someplace and to get vaccinated and they said they're giving out Johnson & Johnson, would I be silly to refuse it?
Yeah, so Audra, what I said early on is that we were actually pretty spoiled by the data from Moderna and Pfizer to have a 95% efficacy rate. Because when the other information came out, people said, oh, that's not as good, but actually it's really good. If you look at the data in the US for the Johnson & Johnson vaccine, it's actually, it's 82% overall, but for severe disease, it's much higher, right? So it's this, when we're talking 82%, it's people that are getting sort of mild cold-like illnesses. And again, that's okay. You know, we can all live with a cold. What we're really trying to prevent is being hospitalized and dying. So, you know, I would say that whatever vaccine we're able to get, when we're able to get it, we should take it.
Okay.
Glenda, apologies to everybody who's on the call, but we know each other and used to work together.
We haven't seen each other in years.
So, no, we live in JP. So do it. Whatever vaccine you get offered, just do it. Okay. My mother got the Pfizer vaccine on Friday and is gonna do the second one later in the month. So whatever you get offered, it's gonna be an advantage to you no matter what. So just go for it.
Okay, thank you.
Actually, dovetailing off of that, there's a question around right now, is there any certain priority about getting everyone to get their first dose? How do you deal with situations where if you've gotten your first dose, it's become more challenging to schedule the second dose relative to people who are still waiting to get the first dose?
Yeah. So I've not been to all the vaccine sites, only some of them, but after your first dose, you do get a flyer, like some information that has a contact number, and then you can use that number to schedule your second dose.
Actually, can I respond to that? Because I took my mother on Friday to get her dose at Brigham, and there were people there who were going around scheduling the second dose right live, you know, right there. So I guess it depends on where you go for your dose.
Yeah,
So
exactly.
it is possible.
Yep. So for the hospital-based vaccinations, it sounds like they are scheduling the second dose, but if you go through the community vaccination sites that are available through maimmunizations.org, they are scheduling second doses through email, through email.
Yeah, I mean, again, just thinking about,
Good to know.
so we just got a note today from MGB saying they're going to stop scheduling new first doses because they haven't yet. It's not clear what the supply chain is for what's coming down the road. So they want to make sure everyone can get their second dose. So I would not be surprised, just given how implementation goes and the challenges with it, if some sites are, you know, if you got your first one at Gillette, for example, you know, maybe they're not sure yet what their supply is going to be when it's time for your second. And it may take, this is where it's implementation is hard. It may take going to different sites and looking at different sites to try to schedule the second one. I don't have a fix for it, but I guess I'm not that surprised by it, given how everything's gone.
There's a question regarding how do you document comorbidity, and I think at this time it's going to be the honor system where they ask you to attest it. So yeah, so probably no documentation. It's going to be very hard to document that.
Hey, David, this is Karen. I didn't drop anything in the chat box because I think my question is going to be kind of long. So you go through the vaccination, you get your first vaccine, you get your second one. So, and we don't know how long the vaccine lasts. So, and then I think I heard that even though you are vaccinated, you still should wear a mask and you still should practice social distancing and sanitation, washing your hands and all of that. So the vaccine in itself, I mean, because I think people think once they get the second shot that they're all clear and they don't have to do anything thereafter as far as protection.
Karen, thank you so much for raising that. So that was something that we should have covered, and we will cover if there's a session 2.0 of this. After you get your vaccine, you still need to practice social distancing, wash your hands, and wear a mask. Regardless of your vaccination status, that is the current recommendation right now. Last night, the CDC did issue a new guidance that people who have been fully vaccinated and 2 weeks out of their second vaccination, and if they were exposed to someone with COVID, no longer need to quarantine for the 14 days as long as they remain asymptomatic. So that's a new guidance issued by the CDC last night. But the current guidance by the CDC still is after vaccination, you should still practice mask wearing and social distancing. Lisa, anything else to add to that?
No, I mean, I guess the two things I would add is one is just going back to this issue of not knowing how worried we should be about asymptomatic spread. So if you got a very mild infection, because they're not 100%, if you got a very mild infection and you had dinner with your friend who hasn't been vaccinated, who happens to be immunocompromised, then you would put that person at risk. And so that's why until more of the population is vaccinated, there's still that recommendation in place. I think the other thing is just how can I say the social norm of mask wearing, essentially. It's for so long, masks were seen in some communities as a weakness. That there was this divide about who, should we wear masks, should we not wear masks? And so if you have people going around not wearing masks, it perhaps until we're all vaccinated sends the wrong message that, we don't need to wear masks anymore. And perhaps put someone, just if you think about our community, making someone else more comfortable or less comfortable. Hope that makes sense.
Any other questions?
A question regarding mask wearing. The current they're suggesting wearing 2 masks. I was just curious if you had any thoughts on post or pre-vaccination use of 2 masks.
Yeah, I mean, so that comes with these new variants, which seem to be 35 to 40% more effective at transmission. And so I think, and the 2 masks, especially if it's either 2 surgical masks or a surgical mask with a cloth mask, approach, or not as effective, but approach an N95. And there has been some increasing push towards people wearing N95s because there is a lot of concern about the transmission of these variants. Whether or not that should go down with after people are vaccinated, I don't know that I have enough data yet to recommend for or against that. I think in general, the 2 masks right now make good sense, especially if you're in a tight place. If you're outside taking a walk, if you're outside exercising, if you're at a playground, no. I mean, I don't. That's not where we're worried. But if you're in a tight place with a lot of people, on a bus, if you have to be, at work and there's a big crowd around you, that's where the 2 masks to me make sense.
Okay. Anything else? Feel free to unmute yourself.
Hey, David and
Yes.
Lisa, I just would suggest that maybe one of your last slides would be focused on this, because we went through the whole development of the vaccine, the distribution of the vaccine, and then at the end, we still have to wear a mask. I mean, the safest thing is to still wear a mask. So I think that especially with our older population, it would be very helpful to make sure that we communicate that to them, that they still have to protect themselves, to wear masks and to do, social distancing, and not just go around your family that you haven't seen in over a year or close to a year. But that I think that would be helpful. Thank you.
Thank you for that feedback.
Thank you.
Okay. Well, thank you so much, everyone. This session has also been recorded, and I'll send David O the recording, and he'll post it somewhere as well for future reference. But thank you so much for coming and for all of your questions, and we'll say goodbye. Stay
And
safe.
Thank you very much, Lisa. Thank you very much, David. We enjoyed
David,
it.
Thank you very much.
Thanks everybody for coming. And we did this, I just want to point out, we put this together on very short notice, and we'd like to get this information out to a much larger audience if possible. So if you know anybody who could use this information, as David says, we're going to post the entire presentation recording, so you'll be able to play it at your leisure at at various locations, and just tell everybody about it. I realize the city is doing a similar, but it's not exactly the same kind of presentation tomorrow. It's aimed more at older people and their families. And the more we can get this information out, the wider we can make it available, the better. And that's why we sponsored this and put this together in the first place. And many, many thanks to David and his colleagues for doing this.
thank
Thank
you.
you.